AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
This slide shows the three most common types of inhaler in the market now. Middle dose inhaler is a common one that we prescribe. It can be in the form of albuterol, a quick asthma reliever. It can also deliver a controller medication like inhaled steroid. So when a patient actually device by pushing it, the medication will be released from this mouthpiece, and the patient can inhale it into the lung. It is critical and important that your physician or the pharmacist has to teach you how to use it correctly, because incorrect usage is a common cause for treatment failure. So it's important to use it correctly. And for some patients, like for example, very young children, or old patient, that they cannot follow direction exactly how to coordinate use the medicine. So sometimes we might prescribe a holding chamber to improve the delivery of the medication. This is a nebulizer. This is a machine activated by electricity. It aerosolizes the medication in the holding chamber, make it become an aerosol so the patient can comfortably inhale and get the medication in the lung. Usually we prescribe for a patient who is very young, infant, very young children. We cannot use the handheld inhaler to improve the delivery of the medication. With the COVID-19 coronavirus pandemic for the past few months, we have stopped using this type of nebulizer if possible in the clinic setting and also in the hospital setting, unless you're in a special room. The reasoning behind that is that if you are a carrier of the COVID-19 virus, or if you are infected, that's why you have the asthma attack in the first place. And then if you use this machine, you can potentially aerosolize the virus and infecting other people in the clinic or in the hospital. So if the patient have to use it at home, for the past couple of months, I have advised the patient to use this in a room with door closed, and nobody should enter the room for about 2 hours after the nebulizers in order to prevent spread of the virus to family members. On the right side is another common inhaler we prescribe. And this is a dry powder form of inhaler. It is developed to improve the delivery of the medication, because the medication can only be delivered when the patient inhales through the device. Of course, you have to ask your physician and pharmacist how to use it, because sometimes patients can still use it incorrectly. Like for example, one of my patients never activated the device by pushing a button to the other side, and thus never get any medication. So again, talk to your primary doctor who prescribe it, and or the pharmacist how to use the medication in order to make sure that you use it correctly to prevent treatment failure. Well, with the former medication not helpful, so primary care doctor or the pediatrician might have to refer you to see the asthma specialist or the allergist. And this is the patient that have allergy causing asthma, and the medication is not sufficient. So we this patient allergy shot basically is like an immunization. We give the patient what they're allergic to, like cat dander or dust mite, and try to make them immune to the stuff they're allergic to, and thus prevent the asthma. And for past 10 to 15 years, we also have man-made antibody that can reduce the allergy in the body and thus reduce asthma. In the past few years, we have other biological man-made antibody available for the treatment of asthma. All these specialized medicines are usually given by the asthma specialist. So if the treatment is not sufficient with traditional means, with medication, inhaler, your primary doctor might have to refer you to see the asthma specialist for this type of more advanced treatment.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.